All right. It's been a few months now since I put an update, so this will be the quickest check-in I can possibly do. So we're a little over 8 months. Let's see, 8 months and a week since my aortic valve replacement and Bentall procedure to fix the aortic root aneurysm. So what's happened since the last one, which was a 6-month update, is pretty much life has gotten back to very close to normal. Um, I've had 2 INR checks since then. The first was 1.8. My last one this past month was 2.2, and so it was a little bit high, but we didn't make any changes to the medication for a couple of reasons. One, it hasn't really been affecting me. I still feel I'm personally okay in that range. I like to be in the 1.5 to 2 range, which is where the Onyx valve is approved to be. But 2.2, it's okay. I've had plenty of opportunities to cut myself, as you can see. I'm in my workshop today. I've actually been back in the wood shop doing some different things, and I've busted up my knuckles and cut myself, and nothing crazy there. No real impact sports or anything. So I'm okay with the 2.2. And then the other thing is my 10-year-old son's baseball season started, and I'm an assistant coach for that. So we're eating just way worse right now because we're moving so fast trying to get things done. So I know my diet's been a little bit off, which is probably why that INR went up to 2.2. All that being said, I'm at a 5-week check now, so I'll get it checked again in about 3 weeks. And then as long as it's still in that range, I'll move to a 6-week check. So that's pretty exciting. Other things that have been going on. So working out has been, 4 or 5 days a week with weight, and I've really increased my weight quite a bit. I'm still being very cautious with my heart rate, and I think a lot of that's still a mental block based off of the VTAC I was having, back in December. But the metoprolol has seemed to completely have fixed my heart rate and the rhythm and the anxiety that was going on in that. And so, but I'm still pretty cautious when I work out. So when I've still been doing interval running as well as weights, and when I get in the low 150s, I'll cut back and let my heart rate kind of drop back down. But I feel pretty good, so I think I might start pushing that a little bit harder coming up. But again, it's not really a big change to what I was doing. But again, I'm looking forward to continuing to push that more and more. But I feel pretty comfortable right now. So again, mentioning life being back to normal. Like I said, I've been back in the wood shop making some things, which has been a great kind of stress relief, and also feels, again, good to get back to normal. Been in the office every day basically since the beginning of the year, which again just helps move my mind mentally on, and I really don't think about it most of the time. My son's baseball stuff has started off, so we have some long days now where I'm leaving for the office at about 6:45 in the morning, and then by the time we get home and have a game and get everybody put to bed, it's after 10 p.m. And so to be able to continue throughout the day with the energy I need is great. And again, I don't really think about any limitations during those normal activities. A couple of things though that maybe I mentioned in the last video, and I'll continue to mention. So one is I was having this pain that came across my chest, and kind of determined it was probably something in the nerves. And so I've been going to a chiropractor now for the last 2 months. I finally felt comfortable to do that, and doing some adjustments. I've got some stuff in the back, and it seems to have really helped some of this nerves, but it'll still wrap around right through here sometimes. But I think we found that it may actually be in my back, or at least that's helping me. So I'm thankful for that. That's really the only thing that's lingering that kind of keeps bothering me. But I think that's just something that I'll eventually work out. And like I said, the chiropractor seems to be really helping me with that piece. The other thing I've done since the last video is I did see a counselor for a few sessions too, because of the anxiety that I was having, and I don't know if that was what was causing VTAC or the VTAC was being caused by that. Again, the metoprolol seems to have cut all of that out, even the anxious feelings and things that I was having. But I still went and saw a counselor for for 5 or 6 sessions and just talk through some things just to make sure that I was really processing what was going on, because obviously this is a huge life deal, and everything just kind of stops, and then just getting back going and everything that was happening. So, if you are in a similar position, I would say please find a counselor, go talk to somebody, because it does help to be able to get those questions and be able to kind of walk through what you've been feeling. But again, overall, I would say I've been feeling great. I did get hit, so I've got a bruise right here. You probably won't be able to see, but it's about that big around where a baseball hit me at practice the other day, and you probably can't even see where I'm pointing on my knee. But I had a baseball hit me in the side of the knee, and I was anticipating my warfarin bruise to be my entire leg, but it seems to be holding out the size of about a softball. So that's nice. Nothing too dramatic there. Again, I hadn't posted in a little while because I don't want to keep posting videos every month and nothing really changing. But I would say the big things over the last 2 months is INRs has been fine. I've had no real issues with medicine. I've actually had a work trip, and then with all the late baseball practices and games, there's a couple times when I've just kind of boneheaded forgot my medication, but I have the little pill divider for each day, but I've forgotten it and taken it a little bit later. It's no big deal to me, and the doctor seems to be fine with it too. So that's all good. No issues there. This little nerve pain I've been having, it seems like it could be in the back, but again, it hasn't prevented me from doing anything. And knowing now that it is nerve related has really cleared up my mind to feel more free as I'm working out, as I'm running, as I'm doing other activities. But life is going back to normal, which is great. There are, multiple days on end now where I don't even think about the tick that I hear, which I know can be heard even in these videos because it is sometimes quite loud. But I've really kind of gotten to the piece now when I've been so busy that I never even really think about it, which is good. It means it's working the way it's supposed to, and I'm feeling back to normal. And sometimes it's odd to stop and think like, man, wow, last year about this time is when I found out I needed to have the surgery. And so, what a difference a year can make. But I'm super thankful for everybody that watches and comments. And again, hopefully this does help encourage you along the way. If you're going through this process or know somebody else that is, I would say that, it's definitely life-changing in a lot of good ways. And you'll probably discover some things about yourself along the way as well. So, but anyway, that's what's been going on with me. Again, back to normal activities, strength exercises with heavier weight, doing more running and a little bit more cardio. I actually did a few burpees yesterday just to prove to myself I could. So I may start doing a little bit more of that as well. Still watching my heart rate, but moving along pretty well there. Back in the wood shop making things, I've made several things. You can see some benches I'm working on in the background now. So this has been a great outlet for me because it's something I enjoy doing. And again, my hands have been cut up, and I've been banged around in the shop, and nothing crazy has happened with the warfarin. So again, that's something that I can be thankful for. Back to coaching my son's baseball team, which was really, really great, because this is maybe the last year I'll get to coach him in the setting that we're doing, coaching with a friend, and his boys are on the team too. So that's been great. And work and everything else, it seems to be kind of going, and life is back to normal. So doesn't mean it will stay that way. There's always stuff going on. I have my first dental cleaning next week, so I've got my prescription to pick up for my 2,000 milligrams of amoxicillin to take beforehand. But I don't anticipate any issues there either. But that's really it. This was really rambling and short. I was messing around doing some stuff, and I thought, let me make a quick video. So again, thank you for watching. Share this with anybody that you think may need some encouragement along the way, or somebody to look at and realize maybe you're doing better than I am. And I think that's awesome. If you're not, that's okay. It takes time. I'm learning patience. In my brain, I thought by the end of the last year, so 6 months out, I'd have been 100% back to normal. And for me, it's taken a little bit longer. And so I'm learning patience in this, and maybe you will too. But again, if you're going through this, keep going. Thanks for watching, and I'll post another video whenever there's something else going on.